That was a nice question, actually. It's a good question, too. So the noble fight against the invisible enemy has inflicted a steep toll on the American workforce. As we all know, millions of Americans sacrificed their jobs in order to battle the virus and save the lives of our fellow citizens. We have a solemn duty to ensure these unemployed Americans regain their jobs and their livelihoods. Therefore, in order to protect American workers, I will be issuing a temporary suspension of immigration into the United States. You heard about that last night. By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important. It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad. We must first take care of the American worker, take care of the American worker. This pause will be in effect for 60 days, after which the need for any extension or modification will be evaluated by myself and a group of people based on economic conditions at the time. This order will only apply to individuals seeking a permanent residency. In other words, those receiving green cards, big factor, will not apply to those entering on a temporary basis. As we move forward, we'll examine what additional immigration-related measures should be put in place to protect U.S. workers. We want to protect our U.S. workers, and I think as we move forward, we will become more and more protective of them. This pause on new immigration will also help to conserve vital medical resources for American citizens. A short break from new immigration, depending on the time we're talking about, will protect the solvency of our healthcare system and provide relief to jobless Americans. Today, Vice President Pence visited the hardworking men and women of General Electric Healthcare in Madison, Wisconsin, who are working 3 shifts a day to quadruple their production of ventilators. We're way ahead of schedule on ventilators, as you know. That's why it's never brought up by the media. They don't like to bring things up when we're doing so well. GE is also working with Ford to make 50,000 ventilators in the next 100 days, more than our entire country typically produces in a very long period of time, doing that in a matter of a few weeks and a few days. Earlier today, I had a very productive meeting with Governor Cuomo, as you probably saw, to discuss his statewide testing strategy and how we can work together to help expand it, with the goal of doubling testing in the next few weeks. And New York State will be continuing to control the testing of their citizens and will also manage their state and local laboratories. They have a lot of great laboratories there, more than anybody would ever have known, frankly. The federal government will work along with the state on the national manufacturers and distributors. Together, we'll all work together to help them secure additional tests, and we hope that this model will work with the other states as well. I think it will, for the most part. New York has a lot of very exceptional laboratories, but most of the states do. You saw the chart yesterday. Most of the states do. I'm proud of the relationship my administration has forged with New York, and I can say very honestly with New York State and New York City. They've been terrific to work with. The New York metropolitan area has been the epicenter of the outbreak here in America, and the federal government has spared no expense or resource to get New Yorkers the care they need and the care they deserve. We've sent over 5 million masks. We had 5 million masks, and now that number, as of about 2 days from now, will be more than doubled. Thousands of ventilators. In fact, so many ventilators that the governor is going to be sending up some to Massachusetts and a couple of other locations. We have a great deal of ventilators, which people thought would be impossible about a month ago. Thousands of hospital beds, and the USNS Comfort was sent, as you know, to New York, and it was originally for more of a normal medical purpose, and we changed it over so that it could take care of people that had the unfortunate circumstance of going through the problem that we know so well, unfortunately, that we know so well. I said from the beginning that no American who needs a ventilator would be denied a ventilator, and we have kept that promise all over the United States. Think of that. Other countries are desperate for ventilators. They have many deaths because they don't have a ventilator. And I've asked Andrew if we could bring the Comfort back to its base in Virginia so that we can have it for other locations, and he said we would be able to do that. Javits Center has been a great help to them, but we'll be bringing the ship back at the earliest time, and we'll get it ready for its next mission, which will, I'm sure, be a very important one also. But it was an honor. They reconverted it after it got there into handling an event that they were not expecting to be handling. The FDA has now authorized more than 50 diagnostic tests, including, as of late last night, the first test that a patient can take home. He can take it at home, and it's highly accurate. LabCorp intends to make the home collection kits available to consumers in most states with a doctor's order in the coming weeks. We also have 4 different antibody tests already authorized. Tests will help identify individuals who can donate convalescent plasma, thus providing potentially life-saving antibodies to American patients. Dr. Hahn will be providing you with an update on these developments in a few moments. He's done a great job at the FDA. We continue to gain ground in the war against the unseen enemy, and I see light at the end of the tunnel. I actually see a lot of light at the end of the tunnel, and we're starting the process. We're starting a very, very powerful, important process. You see that people are getting very anxious. They want to get going. They want to get back to their jobs. They want to make money. They want to take care of their families. So the light is getting brighter and brighter every day. And with that, if I could, I'll ask Dr. Birx to come up, and then Dr. Hahn. Thank you very much.